Assalamualaikum warahmatullahi wabarakatuh. Good morning, good afternoon, good evening. My name is Yudhistira Syihab. I'm from Medical Faculty of Sultan Agung Islamic University, Semarang in Indonesia. As you can see in the screen I shared, today in this occasions, I will talk about and sharing my understanding about two refractive errors. One is short-sightedness, and then the second one is long-sightedness. Okay, let's move on. So, as I mentioned before, I will talk about visions, eye. First thing first, I'm gonna talk about normal visions, and then I give you short introductions about normal visions, and then I will talk about refractive errors, and the treatment, which I mentioned before, is short and long sightedness. Move on. What is normal visions? 2020 means normal visions. 2020 is a term used to express normal visions or visual acuity tested by reading a Snellen eye chart at a distance of 20 feet or maybe 6 to 7 meters. If you have 20 per 20 visions, you can see clearly at 20 feet or 6 meters what a person with normal vision can see at 20 feet. So calling normal vision is 20/20 vision is actually true for eye care professional in the United States of America, but not everywhere in the world. In Europe, in the Asian countries, in Indonesia including, eye care professional would say that normal vision is 6/6 because we use different measurement from US. Instead of feet, we use meters. Can our vision be better than 20 per 20 vision? Yes. Having 20 per 20 or 6 per 6 visions is meaning you have average visions. So 20 per 20 vision is actually or technically considered not so perfect. Some people, mostly children, have visions better than 20/20. Maybe something like 20/15 or 20/10. This means that you can see something 20 feet away that most people can see when they are 15 feet away or 10 feet away. So let's move on to the next slide. Okay, so to understand the eye disorder, we must first understand how the vision help us to see around us, to see the object in front of us, to see the everything. So let me turn now how our eyes see. Our eyes work in a similar way, very similar way to a camera. But in fact, camera itself is inspired by our eyes. So different part of our eyes working together to send visual informations to brain. So this process all happen very quick, and then making our eyes can refract the light. So when you look at the object, the light reflected from object enter your eyes through the cornea and then goes to your lens. Your pupil gets bigger and smaller to control the amount of light that gets into your eyes. Your cornea and lens refract or bending the light to bring your what you seeing into focus. Light reaches the retina at the back of our eyes, and the retina changes the image into electrical impulse or signal. The optic nerve transfers this signal to the part of your brain that's responsible for vision, or the visual cortex. The optic nerve carries signal from both eye at once. Our brains interprets what we see. It combines the visual information from both eyes and bring it together into one clear image. Let's move on to the eye disorder that affect the eye's ability to refract or bending the light. So the shape of our eyes does not bend light correctly, resulting our image, our vision is blurred. This makes it difficult for eyes to focus on what we're seeing. Depending on the type of refractive errors, you may struggle all the time or only in specific situations. The severity of errors determine how much it will affect your visions. Mild error may hardly affect your sight at all, while severe errors may leave you unable to live a normal life without vision corrections. You can have a refractive error in one or both eye. When an error is present in both eye, it may not be equally severe in both. So you can also have different refractive error in each of your eyes. You can be long-sighted in the right or left-sighted in the left. There's usually nothing you can do to prevent refractive error from developing in our eyes because they're caused by shape of our eyes, cornea or lens, or changes to this part of our eyes. There's no way to prevent refractive errors. There's also nothing you can do to prevent your child, your sister, your brothers, being born with errors in their eyes. Refractive errors are extremely common. Around 2.3 billion people globally have one or more refractive error affecting their sight. There are four main types of refractive errors here. First is myopia, and then there is hyperopia, and then presbyopia, and astigmatism. So myopia is nearsightedness, hyperopia is farsightedness, presbyopia is an age-related form of farsightedness, and then astigmatism, a blur vision at all distance. Okay, let's move on. The most common symptom of refractive error is blurred vision. Patient report symptom of eye strain and blurring with difficulty and prolonged reading, symptom of double vision, haziness, glare of halos around bright lights, squinting and headache may also occur. Some people may not notice the symptom of refractive error. It's important to get eye exam regularly so your eye doctor can make sure you're seeing as clearly as possible. And if you wear glasses, having the symptom, you might need a new prescription. Talk to your eyes doctor and get an eye exam if you're having trouble with your vision. If errors, eye doctor can correct refractive error with glasses or contact lenses, or fix the refractive error with surgery. Glasses. Eyeglasses are the simplest and safest way to correct refractive errors. Your eye doctor will prescribe the right eyeglass lenses to give you the clearest possible vision. Contact lenses sit on the surface of our eyes and correct refractive errors. Your eye doctor will fit you for the right lenses and show you how to clean and wear them safely. The fourth is LASIK surgery. And then some type of surgery, like laser eye surgery, LASIK surgery, can change the shape of our cornea to fix refractive errors. Our doctors or your doctors can help you decide if surgery is right decision, right choice for you. Let's move on. So short-sightedness or nearsightedness is also known as myopia. It occurs when your eyes cannot focus clearly on object in the distance. You can be short-sighted in your cornea if your cornea is too curved or if your eyeball is too long. When this happens, like rays coming into your eyes, focus slightly in front of your retina rather than uh, set of it, making faraway object look so fuzzy. Short-sightedness, on the other hand, causes object away to appear blurred, which can affect your vision when you are driving, playing sport, trying to recognize your friend, your family, and object at a distance. This can lead to eye strain, headache, and fatigue. Let's move on. Farsightedness or hyperopia make it fairly easy to see object quite some distance away. But objects at less than arm length are blurred. It's the opposite of myopia. If you have farsighted, you might be able to read words on screen on the other side of the room clearly, but you will struggle to read the notes you're typing on your laptop or right in front of you. Your eye growing too short from front back to that causes you have farsightedness. Another cause is your cornea or lens being too flat, and this defect cause light ray to focus just behind the retina. People with farsightedness are usually born with it. Okay. Hypermetropia or long-sightedness affect the way you see object in close range. People who suffer from long sight are usually able to see object in the distance clearly, but not those nearby. You can see long-sighted if your eyeball is too short or your cornea too flat. This defect causes light ray to focus just behind the retina, so it's fairly easy to see object quite some distance away. But object at less than arm's length or meters length are blurred. This is usually a result of genetics. If others relative on your family have it, you're more likely to develop it. It is possible for anyone to be long-sighted at any age, but it's almost inevitable that you become more long-sighted as you get older. Age-related long-sightedness is called presbyopia, and it's developed in most people in their mid-40s. It's not a disease, but a result of natural eye aging, in which the lens inside of eye become very uh, less flexible. So let's move on. Thank you. Maybe that's all from me. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.